I am doing my career presentation on addiction professionals. I chose the Spring Hill recovery location here in Ashby, Massachusetts. They were not able to respond to me quickly, so I did most of my research with my dear friend Google. The work environment, much of the addiction professionals or professionals that I searched on can work in outpatient centers, residential mental facilities, mental health and substance abuse facilities, individual and family services, government, medical and surgical hospitals. They can do inpatient care, which would be a detox program or a halfway house, and even juvenile detention centers. So outpatient work can be from 9 to 5, typical office hours, or the inpatients, detox programs, and other facilities of that nature can be 24 hours. So you choose your shifts that you want to work, but they're around the clock, so you work with that time frame. These stressors are, of course, working with addictions. I loved a quote that I read from a substance abuse counselor, The Life in the Day of. She says, the challenging high rate of burnout due to the behavior accompanying the dependence, such as lying, stealing, splitting, etc. Too often counselors manage clients based upon the addictive behavior rather than seeing the difficulties that drive that behavior. I've worked with a few close friends and relatives that have addiction, and they show some of these challenging behaviors, so I've understood that aspect of this career. Typical benefits, I wasn't able to find any specifically in the job searches that I did, but it's my understanding that with most of these careers you're able to get medical, dental, and other health benefits along with your insurance, along with your salary. Common tasks that they do, they are in charge of working with patients to help with detox and the recovery. They work in groups to plan sessions for group services. They help develop treatment plans for individual clients. They work with different staff members to help clients receive their proper care, and they modify treatment plans according to progression or degression of certain clients. It's constantly working with the different individuals with their needs, working with different programs. The education requirements, I looked up the requirements for the state of Massachusetts where I will be receiving my license, and I need to pursue a master or doctoral degree to be registered, and you need a minimum of 270 hours of training after the behavioral science degree is achieved after that. 300 hours of supervised practice training and 6,000 hours of supervised alcoholic and drug counseling work experience, and a written exam here in Massachusetts. The salaries range from $31,000 to $55,000. And interesting, while I was researching this career, I noticed that some states only require a high school diploma and a certification to work with addiction recovery. Massachusetts does have that sort of program, but it's very minimal work. But most states actually allow you to be in charge of programs with this certification. But I'm looking to pursue a master's or higher to be able to work in a rehabilitation center out here in Massachusetts. So, and all of my information, because I wasn't able to contact a human, was cited from the internet. And that is my presentation. Thank you.